Imagine waking up tomorrow morning with your blood pressure exactly where it should be. No dizziness when you stand. No racist true heart after your first cup of coffee. No waking up at 3 a.m. to navigate a dark hallway to the bathroom. Just steady, controlled pressure, because your medication is actually doing what it was prescribed to do. That's not wishful thinking. That's what happens when blood pressure medications are taken correctly. And the difference between that outcome and what most people experience isn't a different prescription. It isn't more exercise or a stricter diet. It's 5 specific pieces of information that almost nobody shares with you at the moment it actually matters. Here's what I've seen over more than 2 decades in practice, along with my colleague Dr. Sophia, who runs our chronic care clinic. Most people taking these medications every single day are making at least one of 5 specific mistakes, and the frustrating part, they don't know it. Not because they're careless, because nobody explained it. Not at the pharmacy counter, not on the label inside the box, and often not during the appointment where the prescription was written. Today, I'm going to change that. 5 mistakes, 5 clear corrections. By the time you finish watching, you'll have a fundamentally different understanding of how your medication actually works and what it needs from you to do its job properly. One more thing before we start. Near the end of this video, I'm going to share something that may be more important than all 5 mistakes combined. It's about one specific factor, something your doctor has almost certainly never mentioned, that could be reshaping your entire medication schedule. I'll get there, but I need to build the context first. So stay with me through all 5. Let's begin with something that happens in millions of homes every single morning. You wake up, you take your blood pressure pill, and within a few minutes, you put on the coffee maker. It sounds completely reasonable. Sounds like exactly what a responsible person does. But if you're on a beta blocker, and a significant portion of people with hypertension are, that morning routine is quietly working against your medication. Here's the mechanism. Beta blockers reduce blood pressure by slowing your heart rate and reducing the force of each contraction. That's central to how they work. Caffeine does exactly the opposite. It stimulates your central nervous system, elevates heart rate, and triggers a temporary spike in blood pressure. When both substances are competing in your bloodstream within 20 to 30 minutes of each other, your heart receives contradictory signals. Some people experience palpitations, that fluttering or pounding sensation in the chest. Others feel tightness. Others simply notice their heart behaving in a way that doesn't feel quite right, and they assume that's just how they feel in the morning. When in fact, it's the coffee and the pill having an argument that nobody invited them to have. Meanwhile, your cardiovascular system is caught in the middle, and the medication you took specifically to protect your heart is being partially overwritten by your breakfast beverage. The correction is straightforward. After taking your beta blocker, wait at least 45 minutes before drinking coffee. That interval gives the medication enough time to establish itself in your bloodstream before caffeine arrives. Set a reminder on your phone if the timing is hard to track. Take your pill, drink a glass of water, get dressed, do your morning routine, and have your coffee 45 minutes later. Think of it this way. Your medication needs to clock in before caffeine shows up and starts causing problems. And I'll be honest with you, this interaction applies not just to coffee, strong tea, energy drinks, certain pre-workout products, any significant caffeine source. The window is the same. 45 minutes minimum after your beta blocker before any of them. I'm genuinely curious about something. How many years have you been taking your morning pill alongside your morning coffee without anyone ever mentioning this? Write a number in the comments. I read them and I always find the answers remarkable. Mistake number 2 surprises almost everyone the first time they hear it because this isn't a drug. It has no obvious chemical relationship to blood pressure medication. It's sitting in your kitchen right now, marketed as a healthy choice, grapefruit. I want to be precise here because this is not a general warning about citrus. Orange juice is fine. Lemon, lime, no problem. The concern is grapefruit specifically and to a lesser extent, Seville oranges, which sometimes appear in marmalades. Here's the biochemistry. Grapefruit contains natural compounds called furanocoumarins. These compounds block a specific enzyme in your intestinal wall, an enzyme called CYP3A4. That enzyme is responsible for metabolizing a class of blood pressure medications called calcium channel blockers, drugs like amlodipine, felodipine, and nifedipine, names that may be very familiar to you from your own medicine cabinet. When that enzyme is blocked, the medication isn't processed at the normal rate. Instead of moving through your system as intended and calibrated, it accumulates. Blood levels of the medication can climb to 2, 3, sometimes 4 times the prescribed concentration. You haven't changed your dose. You haven't taken more pills, but your body is now experiencing the equivalent of a double or even triple amount. What follows is a drop in blood pressure that goes far beyond therapeutic, not a controlled reduction, a crash. Severe dizziness, possible fainting, disorientation, and in some individuals, that extreme uncontrolled drop can trigger a cardiovascular event, the very thing the medication was prescribed to prevent. There's a detail that makes this particularly difficult to manage if you try to work around it rather than avoid it entirely. The effect of grapefruit on those enzymes doesn't clear your system in a matter of hours. It can persist for 24 to 72 hours. That means a glass of grapefruit juice this evening can interfere with the pill you take tomorrow morning. Spacing it out during the day doesn't help. Waiting until after you've taken your medication doesn't help. The enzyme is still blocked. The rule is complete avoidance, not reduction, not timing. If you take any calcium channel blocker, grapefruit comes entirely off the menu. If you're not certain whether your medication falls into this category, look at the information leaflet inside your medication box. There's almost always a section on food and drug interactions. Or simply ask Dr. Sophia or your own pharmacist the next time you pick up your prescription. 30 seconds. That's all it takes. Third mistake. This one disproportionately affects older adults, and the consequences are more serious than most people realize because they don't announce themselves immediately. They materialize at 2 in the morning in a dark hallway on the way to the bathroom. We're talking about diuretics, water pills. They're among the most widely prescribed blood pressure medications because they're effective and well understood. They help your kidneys excrete excess sodium and water, which reduces fluid volume in your bloodstream, which lowers the pressure your heart has to work against. The mechanism is clean, the results are real, but the timing matters enormously. When a diuretic is taken in the afternoon or evening, the kidneys respond at night. The body is doing exactly what the medication asks, excreting fluid, but at 2 a.m. instead of 2 in the afternoon, you wake up, then again an hour later, then again before dawn. For someone in their 60s or 70s, that's not just a nuisance. It creates a specific, predictable chain of events. Your blood pressure is at its lowest point while you sleep. Your reflexes are slower. Your sense of balance hasn't fully activated. When the urge wakes you, you sit up quickly, swing your legs over the side of the bed, stand, and your blood pressure drops sharply with the sudden change in position. This is called orthostatic hypotension. And in an older adult whose blood pressure has already been reduced by medication, who is sleep-deprived and disoriented and moving through darkness, the compensatory response can be too slow. The result is dizziness, loss of balance, and in too many cases, a fall. Hip fractures in older adults are not minor injuries. They require surgery. They require extended hospitalization. Recovery can take 6 months or longer with serious complications possible at every stage. Some people never fully regain their mobility or independence. And in a number of those cases, the original trigger was a diuretic taken at the wrong time of day. The fix requires no medication change whatsoever. Take your diuretic in the morning before noon. Ideally, your bathroom trips happen during daylight hours when you're awake, balanced, and fully functional. You sleep through the night, the medication is no less effective. It's doing exactly the same work, just at a time when its side effects can't hurt you. If you're currently taking a water pill in the evening or at bedtime, don't change this on your own before speaking to Dr. Sophia or your own physician. But bring it up. Ask specifically, is there any clinical reason I shouldn't take this in the morning instead? In most cases, there isn't. Mistake number 4. This one comes from the most understandable place. The instinct to fix a mistake you've already made. It's early afternoon. You realize you forgot your morning blood pressure pill, and the thought arrives immediately. I'll take 2 now to make up for it. Double the dose. Cover both periods. Problem solved. Please don't do this. I understand the logic. Missing a dose feels like falling behind. Taking 2 feels like catching up. But blood pressure medications are calibrated for a specific release and absorption rate. A double dose doesn't spread the protection across 2 time periods. It compresses it all into one. And the result is that your blood pressure can fall sharply, suddenly, and severely in a way your cardiovascular system was not prepared for. The symptoms can range from uncomfortable to genuinely dangerous. Extreme dizziness, nausea, a cold sweat, fainting. And if this happens while you're standing, walking, or driving, the consequences go well beyond blood pressure management. A sudden uncontrolled drop in pressure is itself a cardiovascular event. You'd be exchanging one risk for another. Here's what to actually do. Check the specific instructions for your medication. Most blood pressure drugs include clear guidance on missed doses. The typical recommendation is, If you remember within a few hours of when you should have taken it, take it then. If you only realize late in the day, close to your next scheduled dose, skip the missed one and continue your normal routine. One missed dose handled appropriately almost never creates a significant problem. If you're genuinely unsure what applies to your specific medication, call your pharmacist. Not the doctor's office, your pharmacist. That call takes under 2 minutes. I tell my own patients this constantly, and Dr. Sophia does the same in her clinic. The pharmacist is one of the most underused resources available to anyone managing a chronic condition. And if you find yourself regularly forgetting doses, not occasionally, but often, that's worth raising at your next appointment. Some blood pressure medications come in formulations that only need to be taken every 2 days or less frequently. That option exists. You don't have to wrestle with the daily routine that consistently isn't working. And now we reach the 5th mistake. This one is genuinely different from everything I've covered today. The previous 4 involve interactions, risks, and errors that come from using medication improperly. This 5th one occurs even when you take your medication exactly as directed. Same pill, same dose every morning without exception, and it may still not be giving you the cardiovascular protection you believe you're receiving. Let me ask you a question. When does your body actually need blood pressure support the most? Most people would say during the day. When stress is highest, when you're active, when your heart is working harder. Reasonable answer, intuitive answer. It's also not quite right. Your blood pressure is not constant. It follows a biological rhythm tied directly to your body's internal clock, your circadian system. During sleep, blood pressure drops steadily, reaching its lowest point in the early hours of the night. But then something happens. Typically between 5 and 9 in the morning, before most people have gotten out of bed, before coffee, before any activity whatsoever, blood pressure begins rising rapidly and sharply. Cardiologists call this the morning blood pressure surge. And for people with hypertension, this surge can be dramatic. 30, 40, sometimes 50 points within 1 to 2 hours while lying completely still. This is not random. Your body does this deliberately. Cortisol levels begin rising before dawn. Your autonomic nervous system transitions from rest toward readiness. Certain hormones prepare your muscles and organs for the demands of a new day. Blood pressure rises as part of that preparation. The problem is that this same surge places enormous strain on the cardiovascular system, and the statistics reflect exactly that. Heart attacks and strokes are not evenly distributed across the day. They cluster heavily in the window between 6 a.m. and noon. Not because people eat a stressful breakfast, because their blood pressure is already surging before they've had the chance to take their morning pill. Now consider the standard medication routine. You wake up, you take your pill. That medication has an absorption curve. It needs time to be processed and reach therapeutic concentration in the bloodstream. By the time it's working at full strength, you may be approaching mid-morning. The most vulnerable window of the day may have already passed with your medication still building toward effectiveness. What if you took that same medication the night before just before going to sleep? This is exactly what the Hygia chronotherapy trial examined. One of the largest and most rigorous hypertension studies ever conducted. Nearly 20,000 patients followed for more than 6 years. One group took their blood pressure medications in the morning. The other group took the same medications, same doses, at bedtime. The bedtime group showed significantly better control of blood pressure during the early morning hours, the window that matters most. And the finding that genuinely surprised the cardiology community was this. The bedtime group's risk of heart attack, stroke, heart failure, and cardiovascular death was reduced by approximately 45% compared to the morning group. Same drug, same dose, same patients, different time of day, nearly half the risk. Source: Hermida et al., European Heart Journal. This approach has a name, chronotherapy. Timing your medication to align with your body's biological clock rather than with your morning routine. Now, I want to be direct about what this means and equally direct about what it doesn't mean. It doesn't mean you should switch to evening dosing tonight on your own. It doesn't mean morning dosing is wrong for everyone. The Hygia findings have been discussed and debated in the cardiology community, and individual circumstances vary significantly. What it does mean is that the timing of your blood pressure medication is a genuine clinical variable, not a formality, not a matter of personal preference, and it is absolutely worth a direct, specific conversation with your doctor. At your next appointment, use the word chronotherapy. Ask Dr. Sophia or your own physician whether your current timing is aligned with your individual blood pressure pattern. Ask whether your specific medications and health history would make evening dosing appropriate for you. If your doctor is familiar with this area, they'll engage substantively. If they're not, the fact that you're asking creates an important opening. This single conversation, nothing more than asking about when you swallow the pill you're already taking, may offer more cardiovascular protection than almost any other modification to your routine. Now, before you close this video, I need to tell you something I promised at the very beginning. Everything I've covered today is real and evidence-based. For most people watching, applying these corrections will make a meaningful difference. But for a portion of you, and I want to be genuinely honest about this, some of what I've described may not apply or may need to be individually adjusted. Here's why. There is a category of hypertensive patients whose blood pressure doesn't follow the typical nighttime pattern. In most people, pressure dips during sleep and surges in the morning. But in roughly 30 to 40% of hypertensive patients, that nighttime dip doesn't happen. Some show virtually no drop at all. Others, called reverse dippers, actually show higher pressure overnight than during the day. Source: American Heart Association. For these patients, the chronotherapy approach I described in mistake number 5 carries a different risk profile. Taking blood pressure medication at bedtime when pressure is already elevated overnight requires careful individual evaluation. Some non-dippers do better with morning dosing. Some need medication distributed across 2 points in the day. Dr. Sophia has seen this firsthand in her panel. Your doctor can evaluate whether you've ever been assessed for this pattern. And if you haven't, and your hypertension has been difficult to control, that assessment may be worth requesting explicitly. The second thing I want you to consider. If you're taking your medication correctly, right timing, no interactions, no missed doses, and your blood pressure still isn't well controlled, there's a possibility that needs to be on your radar. Sleep apnea. It's significantly underdiagnosed, particularly in men over 50, and it's one of the most common drivers of hypertension that doesn't respond adequately to medication. During the breathing interruptions that characterize sleep apnea, oxygen levels fall, stress hormones surge repeatedly through the night, and blood pressure spikes with each episode. No medication adjustment fully addresses this if the underlying cause is not identified and treated. If you snore heavily, if you wake up feeling unrested despite adequate hours in bed, or if you've been told you stop breathing during sleep, bring this up alongside everything else at your next appointment. Dr. Sophia screens for this routinely in her patients who aren't responding as expected. The two issues are directly and physiologically connected. This is the loop I promised to close at the very start. The one factor that may matter more than any individual mistake isn't one single factor. It's the understanding that your medication works within a larger system. Your body's rhythms, your sleep quality, your individual pressure pattern. Getting the most from your prescription means working with that system. So here is what I want you to do after watching this. Write down which of these 5 mistakes apply to your current routine. Write down the question you want to ask Dr. Sophia, or your own doctor, about chronotherapy and whether your timing is optimized for your pattern. And if sleep apnea has never been evaluated, write that down for the next appointment. 3 questions. That is the action. Before you go, which of these 5 points was new information for you today? The coffee and beta blocker timing, the grapefruit interaction, the nighttime diuretic risk and what it can lead to, the double dose mistake, or the morning surge data and the chronotherapy evidence. Tell me in the comments below. Your answers genuinely shape what Dr. Sophia and I cover next, and we both read them. If this video gave you something useful, a like helps other people who need this information find it. I've also covered the morning blood pressure surge in more detail in another video. What happens physiologically in those early hours, and why the cardiovascular system is particularly vulnerable during that window. The link is in the description. Take what you learned today, bring it to Dr. Sophia, give your medication the conditions it was actually designed to work in. I'll see you in the next one.